Theme tune on, dancing shoes on. I hope, like me, you to remember that you are blessed and highly favoured, a magnet for miracles, the solution to somebody's problem, and the answer to someone's prayer. I am Jenni Russell, and this is UK Health Radio, and this is Her Health and Happiness, your only real feel-good radio station, now available on Alexa. Dancing, how you doing? I am so pleased to say that Dr. Loretta Oduware, I'm going to finish saying the rest of her name, right? Her name is so beautiful, and I get tongue-tied saying it. But I have a resident gynaecologist on my show, and when I do introduce her, you'll hear her say her name for herself. But Dr. Loretta is just a breath of fresh air. This beautiful-looking, amazing, holistic gynaecologist is my resident gynaecologist. And this week, we speak cervical cancer, because it is Cervical Cancer Awareness Month, and many people are unaware the fourth biggest killer for females, and nobody's talking about it. So let's talk cervical cancer. But I just listened to an amazing consultant surgeon, and he just gave the inside scoop really on what's going on in the NHS, and just thinking about where we are. And what he's saying is that COVID was a great reset. Because, you know, people had opportunities to the Great Resignation. They had opportunities to look at really what their life was like. I suppose if you're on the front line, which none of us are thinking about, and obviously you're seeing people coming in and dying, but you're seeing your colleagues. Remember, there was lots of healthcare workers that were struggling. I suppose you watch your colleagues, right? You're watching your colleagues, and you're seeing many of your colleagues are on ventilators. You're seeing many of your colleagues dying. There was lots of doctors and people dying. And you're watching this pandemic, you know, proliferating, and you're on the front line and you're working inexhaustible hours. We come out and clap for you once a week on a Thursday at 8 o'clock, but that's it. We won't raise your pay. We won't change your working conditions. We'll continue to ask more and more of you, and we'll wonder what's going on. And I think what was really interesting, before we speak to Dr. Loretta, was just some statistics that the doctor shared, this consultant shared. There are 12,000 doctors. So in 2021, 330,000 nurses resigned. 330,000 nurses left the profession. That's huge. Never had that number put out, did we? 12,000 doctors are needed. 50,000 midwives and nurses are needed. 50,000. There are 475,000 health jobs needed by 2030. 475,000. Nurses eating at food banks. And they estimated that their pay has gone down in the last, 12 years by 30%. I think it may have been more than that. I think we've got to look at who we believe deserves the honour and the glory. I suppose, like you said, when you're looking at what a footballer earns in 1 week, that a surgeon earns in 1 year, we've got everything upside down. We pay extortionate amounts for entertainment and say they are worth it. And then we beg the people that we pay pennies to save our life and trash theirs. When he talked about not being at family functions, not being able to missing Christmas, to missing holidays, all of those things they miss. You know, we've just come out of Christmas, right? Making all the plans for Christmas, who's coming for dinner, who's doing this, who's doing that. But you've got people in hospitals that need to be fed, need to be watered, need to be looked after, need to be entertained. That means the staff that are doing that for them year in, year out aren't having the same for themselves. Sometimes I think we just need to step back and look. And sometimes we just need to ask the government to step back and look. Remember, the MPs gave themselves an 11% pay rise on an 80,000, 90,000 salary, plus all the expenses they can claim for, and then said they won't claim the following year. 11%. Then tell nurses and doctors who save your life, save my life, save everyone else's life, work exhaustible hours and have no life, that 1% is okay, or we just don't have the money. We've got the money to... Look, don't get me wrong, we have to be able to help other people. But even a plane says, if it's crashing, put the oxygen mask on yourself first. It's just when we look at it from a different standpoint, the way in which the media's doing it and portraying it, you can't get an ambulance. And I know it's really sad. I saw one of a lady that died last week, just in my area. Very, very sad. But we've got to put it all into perspective. It is the career they chose. They dedicate their lives to helping others. Maybe we can dedicate a bit of our lives to helping them. That's all I'm saying. But my time is fast spent, and I need to bring Dr. Loretta in right now because we had a jam-packed show. So, let's play our trail and let's bring her straight in.
UK Health Radio, the station that makes you feel good.
Yeah. So anyway, I'm just, that person, you help somebody, I help somebody, we help somebody.
Yes.
That's fine. Yeah.
That's how life goes on, isn't it?
That's exactly how life goes on. And so today, we're here to help the listeners, right, understand what we're talking about today. So today we're talking about cervical cancer. Now, I don't know about this country, but I know in America, January has been designated as cervical cancer awareness month. And it's such a prevalent cancer. It's one of the biggest killers for females, but you don't hear that much about it. So I'm blessed once again to be speaking with the wonderful Dr. Loretta
Oduware Ogboro-Okor.
See, I'm just going to let her say it herself.
Yes, I've just said it.
Dr. Loretta, listen, I'm just coming onto the phone now. I am so blessed, I called her the other day. Hello, gorgeous. Do you want to have a conversation?
I'm like, oh, yes.
Yes. So, Dr. Loretta, welcome to Her Health and Happiness. It's such a pleasure to have you. So, anything gynae now, I'm just going to keep calling you. Let's have this. Let me have a resident doctor. Let me have a resident doctor. Be absolutely fantastic. So, yes. So, I thought to myself, why don't, we're literally 24 days into January, right? So, and we're not talking, I've talked about the new year and what you got and this, that, and the other, but we're not talking cervical cancer. We're not talking anything to do with the cervix. We're not talking its impact. Well, it plays a role in sexual function. It plays a role in bladder support. It plays a role in protecting the uterus. It plays a role in obviously protecting the baby in pregnancy. It plays a role in hormone production. It plays a role in lubrication. So it has to have an impact on menopause. Yes or no?
Yes, it does. It does do all of those things that you've said.
Yeah. So how can, when it comes to, I just saw a report as well today, and I didn't get the chance to finish reading that. That'd be another conversation. That, of course, 1 in 10 women, still out, this came out today, 1 in 10 women are thinking of leaving the workforce because of menopause-related symptoms. And they put this whole government think tank together, paid them millions of pounds to come up with solutions, and the government have rejected quite a few of them. So that's causing an issue. And one of the ones they've rejected is actually giving menopause, making it a condition. It's not a condition. It's a season. But within that season, all the intimate intricacies are affected. And I just thought, with cervical cancer, why don't we talk about the cervix, sex, saving a life, screening? So where would you like to start?
So thank you very much, Jenny. Jenny, you look amazing. Honestly, I'm jealous. You look very well.
Thank you.
And thank you for what you do, you and your team. I think knowledge is power, and we cannot stop talking. We just need to stop. We just need to keep on talking and pushing until we get to that point where, others are pushing as well. So it's like training the trainers, teaching the people, and getting the information going,
little boxing match. Come on.
Yes. I'm very, very well jolly and happy to be your resident gynecologist. Because of what use is knowledge if we don't share it, if we don't empower others. It's absolutely of no use. So today we'll be talking cervical cancer. And the first thing that crosses my mind is, do people even know where their cervixes are or what the cervix is? Yeah. And you've done right to sort of describe it and describe its functions. Now, the womb is made up of, it's commonly called the neck of the womb. That's what it's called. The womb is made up of a body and a neck. And of course, you have the two hands or the tubes that come out from the head, the top. It's a pear-shaped organ turned upside down in the pelvis of women, and it has a body and it has a neck. And the neck is joined to the body by a place called sort of the isthmus. But that's the uterus for you. Now, the neck of the womb is that part of the womb that protrudes into the vagina. So for women, sometimes some women said they've done their own VEs, they felt through their vagina down below, and they felt something that was a bit firm. It felt like the tip of their nose.
Yeah.
That is the cervix. It's nicely conical. When you see it, when you do a speculum and you see it, it's conical and it's a nice pink color. And yes, it is firm, actually. That's the description. It is the rubbery, firm sensation of the nose. Now, what does it do? Some people had erroneously thought over the years that it does nothing. It's just there. But there's actually nothing in the creation of nature, or for those of us who are Christians, who we say God, that is not serving a purpose. So it serves to support the uterus itself. It adds to its support. It also produces, excellent. That's a nice, lovely looking one.
That's mine. That's my cervix.
You are something else, Jenni. Anyway, it serves to support, it helps to produce some discharges, lubrication, like you've mentioned. And it is that part of the womb that is going to open up like the door and let the baby out through the vagina. So it is that part that things are, when they are examining and say you are 1 cm dilated, you are 2 cm dilated, they're actually telling you that the cervix is beginning to
opening out
and open out. So two thins out, which is the effacement, is usually about 2 to 3 cm long. It thins out and then it opens out. So that is the cervix, so a very important organ. Now, if you think about it, from where we are, unfortunately, our listeners haven't seen your one, but if they just think about it, I've just said something interesting, and that is that it is that part that protrudes into the vagina.
Yes.
So that tells us something. That tells us that it is the exposed part.
Yeah, the exposed part.
It's sat there in the vagina, exposed to all of the things that will come into the vagina. The pH that will affect the vagina. Anything that goes on in that place is going to affect that cervix. So you find that it's prone to infections, it's prone to trauma, it's prone to all sorts of things that could happen. So I think it is right for me and Jenni now to tell anybody listening to us that our cervix, therefore, requests, demands, and merits a lot of TLC.
That's right. It's like a bodyguard, isn't it? It's the bodyguard for the security for the uterus. So it kind of stands guard against in my spoken word, I called it the cervix, the orgasmic collector of he. Stands guards against the womb, right? It stands guard to protect the womb.
Yes, and even in certain sexual positions, when women feel a lot of pain, like from the backside, what people commonly call doggy style in quote, you find that shortens the length of the vagina, and the male phallus or penis is actually hitting the cervix.
It's bashing against it, isn't it? Yeah.
That is why you feel that pain. So for those women who tend to feel pain in certain positions, think about it. What's the length of your cervix? What direction is it pointing? Is it pointing up or is it pointing down? You know, or is it like really central? And that will determine what the position you are assuming can determine how much force the phallus is hitting it and how much pain you will get in some cases. Yeah.
And it's actually, so it can be quite painful. But, you know, so if a woman's uterus is retroverted and it points backwards, that kind of vaginal canal, it makes it deeper and longer.
Yes, it does. So it's if the uterus, if the womb itself, that's what Jenni means by the uterus. The womb, the entire body of the womb, if it's retroverted, you're going to find that the neck of the womb is actually like tilting backwards, farther to reach. If it's anteverted, which is the usual thing, then it's actually sort of pointing towards us when we are examining and is easier to reach. So those are some of the interesting things about the cervix. It's important to say it's made up of a lot of nerve endings. It's very sensitive. And for women who have been pregnant and the doctor says, I want to give you a sweep, a stretch and sweep, what they are doing is actually putting a finger through the neck of that womb and stretching it. And that is why it's so uncomfortable. And God bless
crossing my legs.
I know who have had babies, because it is so painful, so discomforting. It's because of the neck of the womb. It's not that the doctor or the midwife is mean. It is just the way it is. The way that place is just going to be very.
Oh my God! Do you know my uterus is retroverted, right?
Okay.
And so when I go for a smear, it's not funny because it's not funny. It's like they're going digging for gold. It's like we haven't got it yet. We have to use it, and I just have to just do breathing.
And do they sometimes tell you, put your hands underneath your bum?
Yeah, put your hands underneath your bum to try and tilt it up and then try to relax. I'm just like, seriously, where are you going? Like, it's ridiculous. But I remember when I had my oldest son 28 years ago, and I was induced. And so the first lot of contractions, they were so light. The nurse was getting really upset with me, the midwife, because she's like, are you counting? I couldn't feel them. And then she said, I'm going to break your water. And my best friend at the time, Ugo's with me. And so we were laughing and joking before, we reading magazines and whatever. And then she's gone in. And of course, retroverted uterus. I'm just like, she's saying to Ugo, keep talking to her and keep trying to get her to relax and laugh. But, when you're laying down and they've got the cloth there, it just looked like she disappeared. So I was holding my breath. I was like, where are you going? Then she came out. She said, I didn't burst it. I have to go back. And I was like, you're joking, right? She went back. And then she managed to, break the sac. But she said, don't laugh. Well, who told her to tell that? I laughed so much. And she had to go and change her clothes. Felt so bad. Just
why did you have face?
That was the last good laugh I had, though. After that, 7 hours of
pain.
Yeah, but I didn't scream like the other people in the other ward next to me. I did not scream like that.
So you have a good pain threshold.
Yeah, well, I had something. Good breathing, sort of good breath technique. But yeah, it makes a big difference then to, obviously, like I said, for when they're doing the smears, that makes a big difference. It can be uncomfortable. But what I really wanted women to understand, I mean, and we talked when we spoke at the weekend, when I published the first book, Can a Vagina Really Buy a Mercedes? At that time, one of my best friends is the singer Sunita, and Sharon Osbourne had a show, and I had an agent then, and we were trying to get this agent not to be so nonchalant about it and speak to, the late Jay Goody, God rest her soul, her partner. Now, I'm not saying, I spoke about this before on radio, I'm not saying that I would have made a difference to her life as such, but based on what the book was about, based on talking about sexual function, it would have been a great topic to have. I suppose in the same way that women don't want to go for the smear is the same way that men don't want to have the prostate exam. But the difference is, if you catch it early, as I spoke when we spoke last time, and I said I had the LEAP surgery and I had part of my cervix removed. If you catch it early, the quality of life and the length of life is, the difference is whether you live or die. Yes?
It is. And in fact, you've just nicely just opened the floodgate to a lot of information we're going to be having today now. I'm going to zoom in straight. So apart from being a sexual organ, helping secretions, helping as a gateway to keep the baby supported and in until 9 months, this cervix is also, like we pointed out, a place where it's exposed to a lot of things. And just to point out, before I even say that the burden is so much. Each year, more than 3,200 women are diagnosed with cervical cancer in the UK, which begs the question that Jenni has been asking. If we say that January is the World Cervical Cancer Month, and the Cervical Cancer Week is 23rd to, I think, 29th, why are we not making a lot more noise about it? We really need to do that. And the interesting thing is, before I even go and talk about, I want to tell us that the two ways to actually treat or manage these conditions is what Jenni has just said. Catch it early, the screening, and the prevention. The screening is catch it early. The prevention these days is actually the vaccinations that are being given. And I'm going to speak about that. But catch it early is the screening. Prevention is far, far cheaper, better, and wiser than cure. And it is less expensive. We must understand that is why the UK government and any healthcare system in the world, what it sought is going to invest in primary healthcare to screen and to catch these ailments early, because the money we spend treating one cancer patient is enough to screen thousands of women and prevent that illness. So how do you take certain actions that would help you to maximize prevention? And the first thing I said to do is to screen. But did you know that in this UK, 1 in 4 women do not attend their cervical cancer test screening?
Wow.
In this UK, where it is free. So Jenni, imagine in places like my home country, Nigeria, where it's not free and where about 103 million people are in multi-dimensional poverty. Imagine the women there will not be able to even go because they don't have this facility. Now, why do people who have this facility still don't go? And even data is showing that the Black and ethnic minority women are more likely not to attend.
Can I just say this one thing, just to interject one there? People that don't pay attention.
I like that. That's a good one. People that don't pay attention. We have to get them to pay attention because life is precious.
But that's what sickness does, doesn't it? Sorry to cut you again. That's what sickness does. You mentioned a second ago, maybe 2 seconds, you mentioned a second ago how expensive it is. There's nothing more expensive than costing you your life.
Yes, that's the truth. And it's really sad because early stage cervical cancer, it doesn't have symptoms. It doesn't talk. It has no microphone. It doesn't make any noise. It's silent. So the best way to catch it is to go for your screening. Science has proven that. And depending on the country in which you live, the screening program may start at different age grade or age groups. It's usually 20 years and above. Scotland and Wales. In England, it's 25, from 25 years of age. And it's usually every 3 years in the first instance until 49 years in the UK. And then it becomes every 5 years thereafter until around about 64, 65 years, depending on that person's birthday. So if you go for what people used to be Papa Nicholas staining, pap smear, that's where it's come from.
Yeah, pap smear.
They use a small brush and take cells from the neck of this womb. Granted that the position is uncomfortable, it is invasive, it's not the most pleasant, but it saves lives. So please, any woman out there today, any man who has got mothers or sisters or female friends, please tell them, let us be responsible for our own health. Listen to the voice of myself and Jenni and decide to go for your next pap smear. Don't be that 1 in that 4. Don't. And please, I understand as well, because the NHS is having to make certain adjustments. There are women whose first language is not English. And we found out in the NHS that if you just send a letter in the post and they're not able to read it. If they do not have people who will translate for them. So there are certain parts of London where they have actually trialed out getting people in certain ethnic communities to actually go out as volunteers in the NHS and knock on the doors of these women and tell them in their own languages that your time for your smear is here.
Wow, that's good.
And read it to them. And that, I think, is really novel. It's been piloted in certain parts of London on the NHS. It's cost intensive, but a lot of the people doing it right now are volunteers, and it is just fabulous. If we can sustain it and go to certain ethnic dense areas, we know certain areas that they have high density of certain languages, actually approach it that way, I think we are going to have a bit more uptick than we are right now.
Which is fantastic. But I want to ask you a question, because what happens is the cervical cancer is linked very much to sexual transmission. It's linked very much to the HPV. So do you think, because it's so linked to that, if women are not so sexually active, number one, number two, think, well, I haven't been sexually active for years, so it doesn't apply to me. How do you know? Number two, do you think because of the association with sexual transmission that women think, well, if I've really not been active as such in my life, then it can't be my issue? Because obviously I know that you can be, the body can become overly acidic, and that can open the gateway to other things. There's other reasons why that cancer can appear. But if people think it's just a HPV related issue, they go, well, I haven't got that, so it's not my problem. Okay.
So HPV, human papilloma virus, is now the most important risk factor for cervical cancer. And people must understand that HPV is a group of about 150 or more related viruses. And they cause different types of growths. A lot of them are called papillomas, and we call them in common everyday language warts. But they can infect the cells on the surface of the skin, lining of the mouth, throat, anus, and all of that. However, they don't really infect internal organs like the lungs or the heart. And then they can spread from one person to the other during skin-to-skin contact or sexual contacts, anal, oral, or vaginal. Yeah. And then you can when if you check it out now, they're going to tell you that there are different types of this HPV. There are those that are not as sinister, that do not cause cancer. And then there are those that are the high risk type. I don't want to go into the complex medical words. I just want to keep it simple. So those that would affect the hands, feet, and all of that, and you see that wart growing, those are seldom really linked to cancer. But the strongly linked ones that cause cervical cancer, vulvar cancer, vaginal cancer, penile cancer in men, and cancer of the anus, mouth, or throat in both male and female are the ones that we are after. And ideally, HPV infections of all types are cleared by the body. So when it enters into the body, it is cleared. But a problem then arises when either you are chronically and repeatedly infected, or your body is not strong enough to clear it away, and it is persistent, and it has been known to remain in people's bodies and be even dormant for years. Okay, so this brings me back to the issue of sexual exposure, because if you are repeatedly exposed to sexual activities, especially from a very young age, so if you have an early age of coitate, i.e. before 18 years of age, then you're at high risk of having HPV sitting there, because those cervical cells at that time are still a bit young and a bit...
They're not developed, are they, fully?
With the hormones. Another thing is repeated sexual exposure. So some of us in high-risk businesses like prostitution, having multiple sexual partners, having the fun of the early life are really exposed. Now, again, if you have one partner, and this is where what you said is going to come, if you have one partner who has had multiple sexual partners, then you are also at risk. So if you say, I'm a nice woman, or I have one partner, this partner met me a virgin, but that partner has had a exposure. partners, then you are exposed as someone too who has had multiple sexual episodes themselves. Now, again, there's the issue of chlamydia. We know that chlamydia is a bacterial infection. But let me tell us here and explain it simply, that if there is anything that compromises the immune system or the consistency of the cervix, it looks like HPV is then happy to have a field day and grow and keep being there, causing the body problems. So chlamydia has been found to exist in the samples taken of women who have had cervical cancer. Studies have shown that they are at higher risk as well. And even if they've had it in the past. So sort of, it looks like when you've had chlamydia, you can't clear the HPV. Doesn't clear. Now, again, another thing is smoking. And when I read the papers on smoking, it's really amazing. I then found out that the simple thing to do is to increase your antioxidants that clears away the free radicals. And this is where lifestyle matters. So smoking, obesity, alcohol, primary smoking or secondary smoking, it doesn't matter. Anything that increases your free radicals will reduce your immune response and not let your body clear the HPV. So if you automatically increase your fruits and vegetables, you are increasing the antioxidants in your body that will clear free radicals. It is the same phenomenon when the immune system is lowered by anything whatsoever, i.e. maybe HIV or even certain medications and certain autoimmune conditions. So medications that can reduce immunity are maybe medications taken after transplants and maybe other conditions that reduce immunity like diabetes as well, and poorly controlled diabetes. And then autoimmune conditions where the body fights itself and you have to take medications to stop all of that. All of those things, when they reduce your immune system reaction, then bang, you have a higher risk.
Pandora's box is open. There we go.
We are not saying that you definitely will then have cancer, but we are saying you have a higher risk of the HPV if you have been infected with it, having a field day and converting itself into cancer. So it then is simple. It's not rocket science that you should go and have your screenings. There are some things that you can't change in life. Some of them also can increase your risk of cervical cancer. A family history where mother, sister, siblings have had cervical cancer can increase a woman's risk if she's from that kind of family. And it's been found that low socioeconomic status in women actually is an intersection for them having raised cervical cancer. And I think that as a social science researcher as well, a qualitative researcher, it's not hard to decipher why there's that intersection. If a woman is from a low socioeconomic strata, the indices are such that she may not have access to screening. She may have had conditions that has pushed her to the extreme to get involved with multiple sexual partners. She may not have a good diet. And all of these things are going to precipitate themselves out of the multidimensional poverty aspects and intersect with her then having a higher risk for cervical cancer.
Yeah, she's going to have a high stress load, low self-esteem. The scale is like this, isn't it? The stress load is up here, the self-esteem is down here.
Yeah.
You know, how does society see me? How am I received? Well, if I, I'm good. I'm good for this. This is where I get some release or some joy or some peace or something. I take what I can get.
Yeah.
But not realizing it.
Yeah.
You're taking a lot more. A lot of times we don't realize that.
And so the point you raised of saying that, oh, I'm a good girl, I'm in the house, I've not been sexually exposed, sometimes it just doesn't hold water because you don't know how truthful partners have been, how much they've disclosed. Because sometimes if a partner is honest and says, oh, I have been quite rough in my early days, the woman can then say, oh, if I was not going to go for my screening, this is a double reason because I heard Jenni and Loretta say this for me to go for my screening. So sometimes it's really good to be open. But I don't know, human beings, we are really strange, weird, and wonderful. I don't know why people want to appear like they are saints. I'm not a saint. I'm not.
No one, right? No one. But you know what? I'm going to take a quick break and then we'll come back on the other side.
That's right.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel
on a really
good.
good point there, and I think this is the thing that when you work with women, when I interviewed you last time, you said when women come in, they suddenly act mute and they don't sort of say, I've got an issue. They kind of point downstairs, and I think there's this whole thing whereby the minute you may start to having some kind of different discharge, or you're not really quite understanding what that pain is, whatever, it's like, do I go and look for help? Do I speak to somebody about what I'm experiencing? Or do I just keep quiet and hope it'll go away? Because it's almost, because that part of the body is the unknown. We don't talk about down there, oh my God, it's like, we don't talk about it. It's like something's happening down there. I'm just going to put a pad in, put my knickers on, leave my house and just act like it's not happening. So, what advice do you give to women, and what are if women don't go for screening and changes, are there any signs that suddenly come along? Because I know sometimes you start getting some bleeding, but are there any other signs that may appear that women could still jump in and get to an early-ish stage, or are there no signs?
Yeah. So first and foremost, it's important to put this out there. Majority, there are no signs until it's too late. Mm-hmm. Yeah, so that's there. However, if you start having abnormal vaginal discharge, chronically smelling, not pleasant at all, you need to seek help. And this is not help just saying, oh, I'm putting on a pad and getting on with it. No. Or I'm going to go and ask my neighbor. No. This is actually seeking professional help. Go to your GP, who, if they think it's above their pay grade, they'll send you to your gynecologist after maybe their own examination.
Ask if you've had a smear. They should be asking that question. When was your last smear?
That's in their remit in the in the primary healthcare land. Now, there are some countries where you don't have organized GPs like we do. So go straight to your gynecologist. Don't go to an ENT surgeon or go to just a roadside pharmacist and expect to get solutions to your vaginal discharge. When you go to a gynecologist, they will do a proper history, do a speculum examination, do a digital or bimanual examination. And with a speculum examination, they will see and look at the consistency of the cervix. If you've not had your smears, they will take certain action. They can send you back, depending on what they see and what they think. If you also sometimes have bleeding after sexual intercourse, please, 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 it is worth going to get it properly investigated. It may be nothing. It may just be an ectropion. It may be cervicitis, just a bit of infection, or it may be a sinister sign of cervical cancer. So please go and investigate these things. If you have pain or discomfort during intercourse, please, please have it investigated, especially if it is constant. There is no position where it is any better. Have it investigated and let the doctors do and say, oh, it's nothing. Sometimes finding nothing can be something.
Yeah. Do you know, I think also the other thing for people is so I had HPV that was
low back pain.
dormant. Yeah, low back pain. All those things are linked, right? So I had HPV that was apparently dormant in me for over 30 years. So I've had my screenings every 3-5 years. But then there are is it 3 different grades or is it 4 different grades?
There are about 3 different grades.
3 different grades. So when they're like sort of 1, they just say, right, okay, they're low, whatever. When they're 2, you've got to watch it. But once it starts to cross that threshold and becomes moderate, you've got to watch it. Once it gets into 3, then they start to worry.
Yeah.
But there are, from the time when they start to tell you there's something lying dormant in your body, and going back to what you said earlier on, the thing that you need to be able to do, which again, they don't give you that information, is make nutrition and lifestyle adjustments, because it's about making sure that your immunity is able to be so high that it's able to, as the Bible says, resist the devil and he will flee from you, right? It's be able to resist any strain of any infection taking hold and proliferating itself. But if you've got weak immunity, if you've got other issues that are going on, because I think, my son says, you can't catch cancer. It's not something that's not infectious. You can't catch it. But if the thing is, 60 years ago, it was 1 in 50. They've done so much research and yet still it's 1 in 2. You cannot say that our lifestyle factors have got nothing to do with this proliferation and where we find ourselves. The more we chase material wealth, the more we push our stress levels, the more convenient we make our lives, the more convenient we make ourselves sick. Would you agree?
I agree wholly with what you've just said. A diet that is low in fruit and vegetables lacks the antioxidants to mop up the free radicals. And don't forget that when I started speaking, I actually said that the body is programmed to clear HPV. So anything that is going to slow that clearance down is not what you need. And there have been intercepts showing that poor dietary intake of all the essential things that are natural and nutritious, that will increase you mopping up those free radicals, is actually not what you need. You need to actually optimize your diet.
And hydration, that's a massive one.
I agree with you. Hydration, optimize your diet, avoid smoking, avoid alcohol, avoid obesity, increase your exercise levels, release those endorphins. Those are the things that are going to help you build your own natural immunity. Anything that reduces your immunity is not going to favor anyone who has persistent HPV. They're not going to be able to clear it. You need to be able to clear it. And that's why I agree with you. And that's why when you have HPV, they make you do your smears every year and see if the HPV is persistent. If it is persistent or if the abnormal cells developing, then we'll send you for colposcopy, which is what Jenni describes that them slicing up. Well, colposcopy is when you go and we do a special staining of that neck of the womb and we look at it under special light, under the microscope. So see if it takes up that special dye. And if it does, it's quite dramatic. You just see it under the microscope. It shows a bit whitish, acetal whitish area.
That's right.
Taking it off. And that is where your gynecologist is going to take a hot look and then slice that away from the neck of them.
I never had any. That's interesting, though. I had the staining twice in the last couple of years. I never had any white cells at all. They just kept saying, there's nothing there, but we think there's something there, which is why I was a bit skeptical, right? But then I had the 1 millimeter, and as the gynecologist was like, well, you're 58, you don't need it. I'm like, well, hold on, slow down. I do.
You do need it.
I need it, right? I do need it. So don't get excited because you said there's nothing there, but you want to take something. So take a little bit and have a look. But because I explained last time, because I hemorrhaged and it was so bad, I was just like, no, I'm not going back. But I made nutritional lifestyle changes so that I said, give me 3 months. And then I made those changes. Now, I've just completed a 60-day challenge with my clients. It's been amazing. Actually, what has been fantastic, Dr. Loretta, is one lady that's been on this challenge has motor neuron disease. She was diagnosed 18 months ago. During that challenge, during the detox that we did in that challenge, her speech significantly improved. The pains and inflammation she had in her joints disappeared, and she lost, from all the steroids, she began to lose weight. So she is so excited, and I'm going to coach her for the next year now, because, understanding the role of the tongue in forward head posture, in digestion, in stability, in gait, in movement ability is, nothing in the body is not linked. And this is what we have to understand, but we're looking at things in isolation. So cervix is the crown and glory of the uterus. Yes, it's the gate. Yes, it's the orgasmic collector. Yes, it's what those men are bashing against and getting excited about. Yes, it's what makes us, jump and have these orgasmic explosions.
Yeah.
But it still plays a role in stability of the pelvis. It plays a role in holding up the bladder. Everything has a role. It plays a role in lubrication as well. So everything in our body has a role. And hydration has a role in looking after cells. Now, anything that we get, any cancer, any HPV, anything, it's at the cellular level that we get sick. It's at the cellular level that we get well. So how can it be that people that get sick don't want to, because we want to keep eating what my surrogate dad calls junk masquerading as food? Why is it we want to stick with things that make us sick and call them treats? Because we're only treating ourselves to sickness and disease. I don't get it, right? And then when we've got to eat good foods, we go, oh, that's boring.
So the interesting thing is that there's what if I go to the Bible now, it says the broad and the narrow way.
That's right.
So the broad way leads to hell, and the narrow way leads to all things.
Very few get through the narrow gate.
Yeah. Now, interestingly, as human beings, I have often asked this question, and the answer I came to, reflecting on it over the years and discussing with people, is that our default mode is what is most easy, what is most gratifying to the senses. That's our default mode. It takes discipline. It takes mastery of self, able to go against the default mode.
And to go against the things of the world.
Yeah.
That's what
And it's interesting because these things that are the negative things are the easier things to do. Imagine, Jenny, it's just so easy in this cold to lie on your couch, hold your remote, and just keep going through Netflix. It is so difficult to get up, put on your running shoes, and go outside and jog. It's really difficult. Now, I don't know about other people, but I can have treadmills in my house, and I don't use them.
Yeah, I had one.
What did I do? There was a day I thought, why am I not using it? It's because I'm always upstairs, maybe watching the news. All right, let me get a television downstairs and put my treadmill right in front of the television. So sometimes
What do they do in the gym? In the gym, everyone's got TVs on the treadmill.
Yeah. So sometimes you have to think out the box and think, what will make me go out of this default mode? If you think about it, our ancestors were gatherers. They were wanderers.
Hunter-gatherers, yeah.
They were out there. They were exposed to
squatting, pushing, pulling, twisting, lifting, jumping.
The things we think. Now, I saw someone the other day. You clap, your light goes off. You can't even get up to turn on.
Hold on. Nah, it's not working here.
Ancestors are going to go, really?
Yeah, we've got so lazy. That's what I said. Conveniently sick.
These things make us conveniently. These are sometimes what they say, diseases of choice. Sometimes, whether we know it or not, cancers can be precipitated by some of our choices. Hypertension is a disease of choice. Diabetes is a disease of choice. Sometimes they are giving these names because...
Hold on 1 second. Say that again, because my listeners need to hear that again. Hypertension is a disease of
choice.
Diabetes is a disease of
choice.
Right. What can I say? I've run out of time yet again. I have run out of time, so I had to cut the interview. Oops. I'll finish it next week, but I just thought it was such a great point to finish on. And I really do hope it's helped somebody and it will help somebody. I will share the picture of my cervix when I do the YouTube video. What I should have done, and I didn't do, is I've actually got those cervix pictures when I put the brown stain on it, so I'll share that as well. So if you go to my Instagram, @pelvicsecrets, you will see it there. If you want to speak to myself or Dr. Loretta, then you can email me at pelvicsecrets@icloud.com. Or you can find me, as I said, at Pelvic Secrets on Twitter and Instagram, Jenni with an I, Russell, on LinkedIn and Facebook. I've got many Facebook pages, The Power Within the Pelvis. All this information will be, those videos will be shared on The Power Within the Pelvis in the next week. But I really do hope that you will take this seriously and it can make a difference to your life. And even in terms of the LEAP surgery and talking about being able to have orgasms after, we share that next week, so please don't be worried. But if you'd like to take part in my 60-day Optimizing Health Challenge, which does start on Wednesday the 1st of March, then of course inbox me, because the testimonies are also going to be shared over the next week or so, and they are amazing. So if you are a person struggling with an autoimmune disease, if you have issues in terms of mobility and shoulder movements, I promise you, when you see those testimonies and see what these ladies have been able to achieve, you'll jump on the next one. There's only 10 spaces. So until next week, in health and happiness, stay blessed, stay safe.